our teachers, both secondary and primary school teachers. But my teacher population for both primary and secondary is 10,000. But it's only 3,800 who has been vaccinated. So, reliably, over 6,000 teachers has not been vaccinated in this county, despite the fact that we have received 25,000 vaccines. And I'm concerned because I would expect teachers to be at the forefront because they are our agents. They are agents of knowledge. They are agents of truth. They are agents of information. And they're at risk because actually COVID is not attacking underage as much. It's mainly inflicting and afflicting adults, and especially those with underlying conditions. We do appreciate that a good number of our teachers are of 40 years and above. So my question is, why are they not being vaccinated? They're actually exposing themselves to danger much more than they're exposing our kids to danger. And I'm seriously concerned. And I would want the Minister of Education to take this very, very seriously. Because first of all, they can infect our kids. But worse still is that they'll be infected. Because it's the other way around that kids are infecting adults much more. So for the safety of our teachers, I persuade them to actually get out and get vaccinated. I also urge the government to bring more vaccines. We are at nail stocks ourselves now. We've done 25,000. And I want to request the government, let us get vaccines from whichever source. So long as those vaccines are certified, one way or another, by global health bodies, let us get the vaccines. Because, I mean, that's the least that we can give our people. So whether vaccines comes from China, whether they come from India, whether they come from Russia, whether they come from America, that is not the question. Let us bring vaccines to our people. And I would even urge the government to bring vaccines, and if it's a matter of cost, then they can tell corporates and corporations and major employers who can manage, who can afford to pay for their employees. And then the government can be left dealing with the common man, the Wanjiko. We can have banks vaccinating their people, and it should actually even be made as a public health condition. The same way you cannot operate a business without a public health certificate. This problem is a public health problem. So you can have banks being made to vaccinate their employees and other organizations and individuals as a public health requirement, so that might be we can ease the burden from government. And then the government is left dealing with Wanjiko and vaccinating all Wanjikos. So mine is to urge the government to bring more vaccines. I'm now at nail stock.